So it is 12:01, and for the sake of getting through a lot of good content, we're going to go ahead and get going so that we have time to hopefully get through as many resources as we have planned to. But if you are expecting to be at a CME session hosted by San Houston State University College of Osteopathic Medicine, fantastic, you are in the right place. If not, I hope it's very informative if it applies to you. But today we're going to be going over our library services and resources and everything that our preceptors have access to. And we want to make sure that you know how to get to the resources or even become familiar with resources you may not be aware of. Without further ado, I'm going to hand it over to our presenter today, Arwen Meador. She is our medical librarian, and she will take over with her presentation. Thank you so much, Arwen.
Great, thank you, Mrs. Browning. I'm very happy to be here to present on library services and resources, and I hope to share information you will find useful in your work with both patients and our students. Okay, so a quick personal introduction. My name is Arwen Meador, and I've provided the phonetic spelling because it's, let's say, a non-traditional name. I am a medical librarian, and currently it's my primary responsibility to serve the teaching, learning, and research needs of the SHSU-COM community, and that includes you, our offsite clinicians. So if there are any questions that we're not able to get to during our time together, please don't hesitate to contact me at the address provided on the screen, and we'll share this again at the end of the presentation. So I like to give my audience some idea of what they can expect from a session. So I provided a brief outline. I aim to cover services and resources in 5 parts: about the library, library services, general access to resources, important clinical tools, and then finally I want to leave you with some tips and tricks for 2 very popular open source resources, PubMed and Google Scholar. Part 1 about the libraries, giving you a broad look at library sites and resources. So technically speaking, there are 2 SHSU libraries, but they're quite different from one another. In terms of physical space, there are 2 library sites. There is the University Library, known as the Newton Gresham Library, or NGL, located on main campus in Huntsville, Texas. This is the principal library where physical items, services, and library personnel are housed. So to access NGL online, you can start from the university's homepage and locate a link to NGL at the bottom of the page in the resources box. And I'm going to stop sharing for just a moment, and I'm going to ask Mrs. Browning to share her screen so that she can demonstrate that pathway for you.
Everyone can see SHSU homepage. And if you scroll all the way down to the bottom, this is the way I like to go. There's going to be a little resources box right here, and you just click on library and it takes you right there.
Great. Thank you. Hopefully we're back to my presentation. Okay, great. So the second library site is the SHSU-COM library, which is located at the COM facility in Conroe, Texas. And so the physical space here is quite small and houses only a handful of physical items, as most of the resources that we utilize are electronic. I am the only librarian currently assigned to COM, and my office is also located here in Conroe in the COM facility. To access those resources that are most relevant to our needs, there is a digital resource guide, and we'll touch more on it in just a moment. To give you an idea of resources, all resources, not just those that are health medical centric, here is a snapshot. So as an affiliate, you have access to more than 1 million books, periodicals, government documents, and more than 400 subscription databases, and subscription means we pay, you don't pay, and hundreds of customized resource guides. So as a clinician, there's more than enough to support you in your work and in your downtime, there's plenty to curiously explore. So part 2 brings us to services, and I've broken this into into two subparts. So A, those services at the university level, and B, those at the COM level. First up are university level services. The primary service to mention at the university level is the virtual assistance available. So whether you need help locating a particular item, finding something on the website, or utilizing a service, you can get immediate assistance by either live chatting, texting, emailing, or calling the library. The live chat is the most popular mode, and it's available even on weekends. On the library's homepage, you're going to want to look for the Ask a Librarian tab on the top right of the page. And it's hard to spot. So again, I'm going to ask Mrs. Browning to demonstrate that pathway for us and that tab.
So this is the homepage for the library, and you'll see right over here, all the way on the right-hand side, kind of hiding, is that Ask a Librarian.
Yeah. Great, thank you. Okay, we're back. I'm having a tiny technical difficulty, but I hope you can see my slide where we're going to talk about interlibrary loan. Okay, so a second important service to mention is interlibrary loan. This is commonly referred to as ILL. This is a service that allows you to request articles that SHSU doesn't have in its collections. So you can create an account in our ILL system and place requests by providing basic bibliographic data about the article. So title and author is enough. It generally only takes 1 to 3 days to receive your requested article, and it's delivered to you electronically through the ILL system. I generally get my articles in less than 24 hours when I place a request. So this is a really great service. So part 2B services, we'll focus on those services that are specific to the COM. So as the medical librarian, I'm here to provide you with research assistance. So teaching and research at this level is more advanced and requires the use of more sophisticated tools and resources. So our resources and discovery process shift from some of those that we're most familiar and comfortable with to those that provide higher quality content and can be more challenging to use. So as you begin to use these resources, know that I'm here to assist you. I can get you the most appropriate resources for teaching and research, help you design effective search strategies, explain proper search technique, and even help you cite your work according to various professional styles. I can also build customized resource guides for you. These are digital spaces that centralize resources and information related to, it's usually a particular discipline, subject, or topic. I like to think of them as one-stop shopping. The screenshot on the slide is an example, and this is a guide that hopefully you will begin using frequently. This is a resource guide for the COM, and we'll use this guide a little later as we demonstrate finding and using clinical tools. So part 3 covers access, both general and specific. And this is where we'll start to get more into some of that demonstration. So first up is general searching. And when I say general searching, I'm referring to a browse for information where the topic is uncomplicated and the format is flexible for you. The library has a search engine known as Engine Orange that will perform what's called a federated search of not all but most of our collections. This search engine is located on the library's homepage, and I'm going to ask Mrs. Browning again to share her screen. I'm going to stop my share. Great. Okay. So on the library's homepage, the Engine Orange search is located near the top of the page. So we're going to perform a keyword search, which is the default type of search. And we're going to use the terms migraine and nutrition. So we'll enter our terms in the search box and click on the blue search button or hit your enter key on your keyboard. Perfect. So you'll notice from the icon accompanying each result that there are items on this topic or related to this topic in a variety of formats. So including ebooks, videos, print books, articles, and more. So you might also notice at the top of your page that we have a very high number of results. So more than 55,000, right? Almost 56,000 results. So to better manage our results, we'll want to take advantage of the filters that are provided on the left-hand side of the page. So Mrs. Browning, let's select the following filters. In the Limit To section, let's select scholarly journals. And next, let's update the beginning publication date in the From field to 2010. Great. And then finally, let's scroll down just a bit and open the subject section to reveal subject headings. And we're going to select migraine. And by doing this, what we're telling the search engine is that we want the term migraine to appear in each record's metadata as a subject field and not just as a free text in any field. Right? So we're narrowing the scope of our search there. And so now we have less than 1,000 results, which is much better. And then you can move through your results and select those items of interest by clicking on the folder icon to the right of the title, or you can access immediately by selecting the full text finder or PDF option that comes under each title. And this is how you perform a very general search for resources on a topic. And we're going to move back to the presentation to introduce our next access tool. Okay. So we're back. And now let's look at finding a journal. If you're in search of a particular journal, we have a search tool that will let you easily find that title if it lives in our collections. Before we demonstrate that tool, though, I do want to touch on the scope of our access to medical journals. We have total access to many. We have limited access to some and no access to others. So some of those that we have limited access to are very well known, like Lancet and New England. In these cases, we have delayed access known as embargoes. So for example, Lancet and New England come with a 3-month delay, and Nature Medicine, another top dog in publishing, has a 1-year delay. On the other hand, we have total access, and I don't have it listed here, but we do have total access to JAMA, and that's the American Medical Association's journal, which is very popular. Okay, Mrs. Browning, let's demonstrate how to find a journal. Let me stop sharing. So we're going to start by visiting the library's homepage, and from the menu on the right-hand side of the page, we'll select Research. We get another submenu, and from there we're going to select Search for Journal Titles. Great. So in our search box at the top of the page, let's enter the title Lancet. All right. Mrs. Browning, just underneath your search box. There you go. There is a blue checkbox and it says keep search limiters. Can you uncheck that box for me? And hit your search button one more time. Okay. So you can notice that there, I'm not sure it's changing our results just a bit, but that's okay. So our first result is the Lancet, and you can see that it gives us an option. What we would typically see is we would see several options. So we'd see several links beneath the title that tells us which resources we have access to the Lancet through. And so when you're met with those types of results, you want to notice the dates that are provided as part of the link and select the option with the broadest access. So for example, Lancet Neurology, which is our number 2 result, you can see that it lives in both of these resources. Now these have equal access, although Nursing and Allied Health does have an embargo, it has a 2-month delay. So then you might want to select the Science Direct link in order to get to Lancet Neurology. So when you select that link, it will take you directly, and should take you directly into the publication. And it'll take you usually into the latest issue. But there will generally, for all of the publications, be near the top of your page, some feature or function that allows you to move to different issues if you need to. And that's how we find a specific journal. Okay, thank you, Mrs. Browning. We're going to move back to our slides. So I'm going to share. Okay. So at the top of the presentation, I mentioned our access to more than 400 databases. These databases cover dozens of disciplines, including health medicine and biomedicine, and their content is free to use. So I want to demonstrate how you can access these resources, but first, I really want to impress upon you the importance of accessing these databases by way of library links. Library links have an authentication measure built in, which is what grants authorized users, you as SHSU affiliates, access to restricted content. That is content that usually requires payment. So you can find your way to PubMed and other public-facing databases through browsers like Google, but you aren't able to access the full text of many sources within those resources without payment, because the internet has no way of knowing or allowing you to tell it that you're an authorized user by way of Sam Houston State University. Right? So in order to get full text access to sources, you want to use library links for databases. Okay, Mrs. Browning, let's demonstrate. I'm going to stop my share. So we're going to make our way back to the library's homepage, and we're going to look to the same menu, but this time we'll select the articles, news, and more option. And this brings us to an A to Z listing of databases. So I recommend using the alphabet at the top of the page to locate a particular database. For our demonstration, we're going to select the letter P for PubMed and scroll to the bottom of the list, and that link will take us into the PubMed database. Okay, Mrs. Browning, so let's perform a search for migraine and nutrition. And if you will clear your filters, there's a highlighted piece just above your first result. It says filters applied, clear all. Great, there we go. Okay, so if we scroll down and look at our first few results, you're going to notice something that says free PMC article. These are open access articles. But if we keep going, so there we go, number 4, we don't see that label. So let's click on the hyperlinked title. Okay, great. And so on the right-hand side of the page, what I want you to notice is that you have full text options, right? Both from the publisher and from the library. And so if we had found our way to PubMed through Google, we would not have been provided with these full text options, but we used that library link. And so we are provided with the full text options, right? Okay, thank you, Mrs. Browning. We're going to pop back over to our presentation to get into clinical tools. So in section 4, I want to introduce or reacquaint you with 2 very well-known clinical tools, UpToDate and Clinical Pharmacology by Clinical Key. UpToDate is a very popular evidence-based point of care tool. It covers 25 specialties and is relatively easy to use. Information is provided topically, and there are some other neat features, including practice guidelines, patient education, and medical calculators. Also, this is a tool that can be accessed through an app on your mobile device, and you'll be provided with instructions on how to get mobile access after the webinar. So Mrs. Browning, she's going to assist us again in demonstrating how to access UpToDate. So I'm going to throw it back to her.
Which, if I'm not mistaken, also gives them opportunity for more CME credit. You can utilize that platform for CME as well.
Yes. So instead of the library's homepage, this time we're going to visit the COM library guide, which is, yep, there we go, perfect. And we're going to select clinical tools from the menu on the left-hand side of the page. And we're going to look for the UpToDate link, which is under that first tab, the point of care tab. And UpToDate there at the bottom. And here we are. So the contents menu, which is located in the top left, if we hover over that menu, it's very self-explanatory. You can get the latest updates on clinical practice changes. You can get drug information, patient-friendly content, and broad topic information. For most clinicians, though, it's the search function that's commonly used to search for a disease or condition, and we're going to demonstrate that function. So Mrs. Browning, let's perform a search for hypertension. Very prevalent chronic condition. And if we select the first option, overview of hypertension in adults, UpToDate will present information on this condition as a topic. So the topics from UpToDate provide us with synthesized information from various reputable sources and recommend treatment and diagnostic measures. So you can use the outline on the left to move through each section of a topic, or you can use the print or share feature at the top right to save or send the topic in its entirety. And then at the end of each topic, you will also find references if you want to learn how the topic was built, or you want to pursue a particular piece of information further. And then lastly, I want to bring your attention back to the top of the page to the register option. It will appear as an orange button should appear in the top as an orange button. There you go. So you're going to need to register for an account within UpToDate in order to gain mobile access and also to be able to engage in that CME. So when you get a chance to come back to this, make sure that one of the first things that you do is register for that account. And this account does not necessarily have to be tied to your SHSU credentials. This can just be a username and password that you make up for yourself. Okay, thank you, Mrs. Browning. We're going to turn our attention back to the presentation for our next clinical tool. Okay, clinical pharmacology. Clinical pharmacology is a drug reference tool that will let you get answers to drug information questions. It also provides drug reports, lists, and calculators. It's updated daily, and it also allows for mobile access like UpToDate. So I do want to demonstrate how you can access clinical pharmacology and give you a quick look at its interface. So we're going to go back. There we go. So from the clinical tools option, we're actually going to go to the drug information tab. There we go. And we're going to look for clinical pharmacology, that link, and click on that link. And here we are. So it's a pretty straightforward interface. There's a search field and then categories of information. We're going to perform a drug search, and we're going to use Zestril as an example. This is a commonly prescribed hypertension medication. So ZESTRI, did it auto-populate for you? RI, I believe is the, it should pop up for us. There we go. So it's going to be your third option under drug monographs. Okay, so the drug monograph will present you with information about a drug using a standardized format, which is outlined on the left, beginning with summary. So you can get a broad overview or look at a particular section like adverse reactions. As your patient, I hope you're always looking at the adverse reactions. I also want to point out the tabs just beneath the drug name. The default tab shows you information about a drug as it relates to all populations, right? But the tab just next to it will present information about a drug as it relates to pediatric patients. And then again, I want to point out the register option at the top of the page. This time we don't get an orange button, but yeah, it's kind of in the same location. Again, you're going to want to make sure that you register for an account so you can gain access to the mobile feature and to other features. Clinical Key is one of those resources where it doesn't give you access to what you might imagine are basic features like printing or saving unless you create an account within the platform. Okay, thank you, Mrs. Browning. So we're going to return to the presentation for a final time to share some tips and tricks. So our fifth and final part shares some tips and tricks for effectively or efficiently using popular sources, PubMed and Google Scholar. I think everybody's familiar with those two. PubMed is the premier resource in medicine and the biomedical sciences. It's comprised of more than 30 million citations with publications being added every day. So there is a lot to make your way through here. To help you do that, I want to share some tips. I've already talked about the importance of using library links to access PubMed, so you have those full text options available to you. But once you begin to search PubMed, be sure that you're not using natural language searches, so the way that you might search Google. Instead of asking PubMed a question like, how do you treat migraines in postmenopausal women, represent your question with just keywords that describe core concepts like women and migraine and postmenopause. So you'll also want to use filters, sort of the same way that we did with our general search using the Engine Orange. Use filters to refine your results and manage the amount of information your search is yielding. Publication date and article type are among the most useful filters in PubMed. And then finally, just like the other clinical tools, UpToDate and pharmacology, I highly recommend creating an account within PubMed so you can save searches and results. And this way, you don't find that you're duplicating your efforts. Oops. Okay, as for Google Scholar, its best feature is something known as library links. And this is a setting that will let you see which items among your results can be found in SHSU's collections. So Mrs. Browning is going to help us out one last time, and we're going to try to demonstrate changing the setting as best we can. There we go. So we're going to select the hamburger menu in the top left of the page. That's the 3 horizontal lines on top of one another. And we're going to select the settings option. And then we're going to select the library links option. And from offsite, you're going to want to search for Sam Houston State University and select it as your library. We, both myself and Mrs. Browning, we're currently on the SHSU network, so it automatically picks that up for us, and you see that those options are already selected. But what you want to make sure you do is click, after you've located Sam Houston and selected it as your library, you want to click the blue button to save your settings. Now, if we perform a search in Google Scholar, it can be any search, we can just do migraine. There we go. So now you're going to notice along with your results that you have a link that's labeled online resources at SHSU. And this indicates that the resource is available in our collections and you have access to it through us. Okay, thank you, Mrs. Browning. Let's share. And thank you to the audience for joining us today. I hope I've shared something that you'll find useful. If there are any questions, if we have time for a couple of questions now, if we don't or we don't get to you, then please don't hesitate to reach out to me. Again, my email address is there on the screen for you. But thank you very much.
Just so everyone is aware, if you do have any questions, there should be a little Q&A that you can click on and put your question in there, and I'm happy to read that. Otherwise, in the chat, I'm going to be putting our survey link. Once you complete that very short little assessment, it will then take you to where you can claim credit. But if you have any questions, I'm going to follow up tomorrow with an email to everyone anyways that will include this recording, as well as the PowerPoint slides, the handout that was referred to earlier in regards to downloading UpToDate on your phone as an app, and anything else that you can think of. Feel free to reach out to either one of us and we're happy to get you taken care of. But we'll wait just a couple of moments in case we have any questions come in, and I'll go ahead and drop that link in the chat now. You're very welcome. I don't see any questions in, so just make sure to copy that link. If not, again, I'll be emailing this to everyone who registered yesterday. So you will get all this information from me in the morning. Otherwise, have a great afternoon and enjoy some of your time back.